Hi, my name is Tharda King, and I will be discussing therapeutic communication with psychiatric patients. Therapeutic communication is a process which nurses provide care for patients in need of psychosocial and medical interventions. Therapeutic communication is effective communication skills that identify the patient's problem by using problem-solving skills. Many patients entering the healthcare facility requires therapeutic communication. Therapeutic communication is extremely important when working with psychiatric patients. Many of these patients have issues with chemical imbalance that requires nurses to use therapeutic communication skills in order to produce a therapeutic relationship with the patients. The purpose of the communication is understanding the meaning of communication, collecting information from the patient, and also to help the patient identify their goals. Therapeutic communication is also important to interact to achieve the goal of using communication techniques. We will discuss the components of communication, tools needed to enhance communication skills, interpersonal communication, and the phases of communication skills. This discussion will be brief because the interaction with the nurse and the patient in the emergency room is a brief interaction. Interpersonal communication. Interpersonal communication is a transaction between the sender and the receiver. The sender is the nurse, the receiver is the patient. The nurse and the patient listen to each other and provide feedback from the interview. Both the sender and the receiver bring in pre-existing conditions to the exchange that influences the intended message and the way in which the message is interpreted. In other words, the nurse will bring in her pre-existing conditions about a patient, and the patient will bring in his or her pre-existing conditions about the healthcare facility. Ultimately, this will have an effect on the communication skills and interpretation of what is being said. So the nurse needs to be aware of her pre-existing conditions at all times. And this is being self-awareness, having some type of self-awareness of what's going on with the individual who will be sending the message. There are 4 components of therapeutic communication, or just communication skills. This is very important when interacting with any individual in the healthcare facility. The 4 components are sender, message, channel, and receiver. This is the basic communication model that we use. The sender will be the nurse. The receiver is the patient in the emergency room. And we're here, when we say patient, we're talking about a psychiatric patient. The message is what the nurse will tell the receiver. The channel is face-to-face. So the components of communication is a face-to-face interaction with the nurse and the patient, where the nurse provides information for the patient in order to achieve the ultimate goal of wellness. Skills needed to enhance therapeutic communication skills. The nurse will be required to build rapport, establish trust, be genuine, and show empathy for the patient. Building rapport is vital for any type of communication to exist. Because the interaction in the emergency room is brief, the nurse will start building rapport at introduction. The nurse will introduce herself and provide the patient with information of what will be happening while in the emergency room. Establishing trust. Simply doing what you explain to the patient. Always explain the process and procedure prior to doing the procedure. This will go a long way with the patient. Many psychiatric patients come in because they're paranoid. They respond to auditory and visual hallucination. And as nurses, we do not want to play into the paranoid behavior. Empathy. Recognizing and acknowledging the patient's feelings. You know, some people come in because of depression. They live alone and they're lonely and sad. Simple communication skills that the nurse can use is by saying it's hard to begin to live alone when you have been married for more than 30 years. This is interacting with a patient whose loved one has passed, or someone that's living alone for the first time in over 30, 40 years. It's showing that you are recognizing and acknowledging the patient's feeling. Genuineness. Being concerned about the patient. Being concerned about what the patient is saying. This for the patient, for a psychiatric patient, lets the patient know that the nurse cares. And as nurses, we do have that caring attitude. So things we can do to enhance the therapeutic communication skills: building rapport, establishing trust, being genuine, and showing empathy for the patient. Phases of therapeutic communication. There are 4 phases we will discuss: pre-interaction phase, orientation or introductory phase, the working phase, and termination phase. Pre-interaction phase. This occurs before the nurse meets the patient. The nurse does a self-assessment prior to interacting with the patient. The orientation or introductory phase is fairly short. Expectations are clarified and mutual goals are set. It is at this phase the nurse begins building rapport. The working phase is the third phase. This is a major portion of the interaction. It accomplishes goals that are outlined. Feedback from the patient is essential during this phase. This is the phase where the nurse provides information to the patient. The nurse completes her assessment, and everything has been clarified and identified for the patient. The last phase is termination. The nurses have to ask the patient if he has any questions. Summarizing the topic is another way to indicate closure in termination. And making sure that the patient has clarity on all healthcare issues. This is a phase where the patient will either be transferred to another unit or discharged back home. Techniques of communication when building a therapeutic relationship with patients are clarifying, or validating, asking open questions, using indirect statement, paraphrasing, summarizing, and focusing. These techniques are important when interacting with any patient. Focusing. Pursuing a topic until the meaning is important or clear and is understood. If the nurse isn't sure what the patient is discussing, he or she can simply say, "Let us talk more about what's going on with your stomach," or "Let us talk more about what's going on with your headache." Asking open questions is important. Asking open questions allow the patient to talk more about the issues, to talk more about what is going on in the visit. Summarizing. This is important in the therapeutic phase of relationship when terminating. Summarizing what has been done in the ED, summarizing the expectation, summarizing follow-up care, allowing the patient to ask questions at this point. Encouraging goal setting is important during summarizing. Paraphrasing what is being said is important. That way the patient knows that the nurse has used active listening skills during the relationship. Now, the next scene you will see a psychiatric patient interact with a nurse in the emergency room. I hope this discussion has enhanced your therapeutic relationship skills and will help foster your nursing skills when assessing a psychiatric patient. Thank you.